Okay, so when I say the word hypnosis, what's the first thing that pops into your head? Is it a swinging pocket watch, someone on a stage clucking like a chicken? Yeah, for most of us, it's all about mind control and goofy entertainment. But, behind that whole stage magic curtain, there's a really powerful and scientifically studied clinical technique. So today, we're going to pull back that curtain and uncover the real story of hypnosis from its super ancient roots all the way to its modern use as a serious medical tool. All right, so here's the plan. We're going to start by tracing this incredible journey from ancient rituals to modern medicine. Then, we'll get right to the heart of it, the power of suggestion. After that, we'll look at how it actually works, check out the amazing range of ways it's used to help people heal, and finally, see how you can actually harness these principles for yourself.
First up, let's talk history. Because to really get what hypnosis is today, you've got to look back at where this whole idea of healing with the mind even started. And trust me, its roots go way, way further back than you might think. I mean, listen to this. It sounds almost like a modern wellness affirmation, right? But this is actually from an ancient Egyptian papyrus scroll. It was an incantation for a patient to chant before taking their medicine. It just goes to show that this core idea has been around for thousands of years, the belief that words, that suggestion, can create real physical change in the body.
So, that ancient idea, it evolved over the centuries. In ancient Greece, you had people going to sleep temples to be healed. Fast forward to the 18th century, and you get Franz Mesmer with his wild, controversial theory of animal magnetism. But the real scientific shift, that came in 1843 with a Scottish surgeon named James Braid. He just tossed out all the mystical stuff and coined the term neurohypnology, which is just Greek for nerve and sleep, to describe what he saw as a real observable state of mind. And that long name, well, it got shortened to what we now call hypnosis.
Braid's work was a total game changer. It really shifted the focus away from magic and mysterious forces and onto the real engine behind it all, the incredible power of suggestion.
So what exactly is a suggestion in this context? Well, it's basically a very carefully worded communication that's designed to guide your own imagination. See, it's not about forcing you to do something against your will, not at all. It's more like a therapist is helping you use your own mind to change how you perceive things, how you feel, and even what you physically sense.
Okay, let's make this real with a classic technique called glove anesthesia. It's a fantastic example. The hypnotist might simply suggest that your hand is becoming totally numb, like you're putting on a thick, heavy, protective glove. And as you focus your imagination on that idea, your brain starts to make that sensation of numbness feel real. Then, the hypnotist can guide you to transfer that numbness just by touching another part of your body. It's an absolutely profound demonstration of how your focused imagination can directly change your physical reality.
So here's the really crucial point. Hypnosis isn't something that's done to you. It is absolutely a process that you actively participate in. Let's break down what's actually going on from your perspective, as the patient. A typical session, what's called a hypnotic induction, isn't mysterious at all when you look at it. It usually starts with something simple, like focusing on your breath to calm everything down. The therapist then uses simple, repeated suggestions, like feeling very relaxed or your limbs feeling very heavy, to help you go deeper into that state. They might walk you through relaxing different muscles one by one, or have you imagine a peaceful, safe place. But through all of this, the key thing is your active engagement. You're the one doing the work of relaxing, focusing, and imagining. And this, of course, is the big question everyone always asks. Is it some kind of special talent? Or, on the flip side, is it a sign of a weak mind? Well, the answer is neither. It has way more to do with your mindset than some kind of built-in trait.
Yeah, research points to 3 really important factors. First, your attitude. Being able to respond well isn't about being gullible or weak-willed. It's a cognitive skill. It's about your willingness to just jump in and participate. Second is your expectation. If you go in believing it can work, you're much more likely to get a good result. And finally, there's cognitive flexibility, which is really just your ability to get totally absorbed in something, like when you lose all track of time reading a good book or watching a movie. It's a skill, not a weakness.
Okay, so we've covered the how, but what about the what for? Where is clinical hypnosis actually being used? This is where it gets really interesting, because the applications are incredibly broad and, for many people, genuinely life-changing.
Just think about going to the dentist. For someone with a severe dental phobia, that fear can be so paralyzing, they might avoid getting necessary care for years. Hypnosis can help them get into a state of deep calm, allowing them to control physical reactions like a gag reflex and finally get the treatment they need without all the terror.
Or what about chronic pain? Now, hypnosis doesn't magically make the physical problem go away, but what it can do is teach patients to change their perception of the pain signals. It's like learning that your brain has a volume dial for your discomfort. You can actually learn to turn it down, to change a sharp, stabbing feeling into more of a dull, manageable background noise. And of course, it's famous for helping people break bad habits. When you're in that focused, hypnotic state, you can rehearse these powerful affirmations like, "For my body, smoking is a poison." This isn't just wishful thinking. It's almost like you're rewriting your own internal programming, strengthening your resolve at a really deep, subconscious level. And because it works so directly on that powerful connection between our minds and our bodies, it can be incredibly effective for what are called psychosomatic disorders. For things like irritable bowel syndrome or stress-induced skin conditions, where anxiety is a direct trigger for physical symptoms. Hypnosis helps calm that mental trigger, which in turn can soothe the physical response.
And finally, it plays such a vital supportive role for cancer patients. Beyond helping manage pain, it can give them a real tool to handle the intense anxiety of their diagnosis and even reduce the awful nausea that often comes with chemotherapy. It can really improve their quality of life during an unbelievably difficult time.
But here's maybe the coolest part. Hypnosis isn't just something a therapist does for you. It's actually a skill you can learn to use for yourself. It's called self-hypnosis. Yeah, people are often taught self-hypnosis as part of their therapy, and it becomes this amazing personal tool. They can use it to rehearse goals, to manage feelings like anxiety or anger right in the moment, or to mentally practice coping with a tough situation that's coming up, like a big presentation or a difficult conversation. It's all about managing daily stress and building self-confidence. This quote just nails why this is so powerful. We all operate based on this internal map of the world, right? It's a collection of all our beliefs and assumptions that we built up from past experiences. But what if that map is faulty or just totally out of date? Think about the person with the dental phobia or the patient managing chronic pain. What they're doing is redrawing that faulty map. They're creating a new one where they have more control and less suffering. Hypnosis is just a way to access and update that map to replace those old unhelpful beliefs with new ones that actually serve you better today.
So, when you strip away all the myths, you see that the true power of hypnosis has nothing to do with losing control of your mind to someone else. It's the exact opposite. It's about learning how to gain more control over your own thoughts, your feelings, and even your physical body. It's a tool for directing your own mind with intention. Which kind of leaves us with one last thought, doesn't it? What could you accomplish if you could do that?